excited as a council member, and this would be ongoing efforts. I don't have any regulatory changes that I'm currently contemplating. Would be happy to work to develop some of those if necessary. I was an early proponent of changes to our smoking ordinance, and in fact, someone up here mentioned the 25-foot rule, that you can't smoke within 25-foot rules, 25 feet of an entrance, and that's actually my ordinance that I passed as a council member. You know, can't think of anything else. I'm going to give you back some time.
Mr. Brown?
Well, I think the city council, led by the mayor, of course, needs to make a better effort in bringing services and improving quality of life in all of our council districts. I'll just mention this. There are multi-service centers in each council district, and that ought to be the nexus, the location for expanded community health services, preventive care, outreach, and even primary care. We have that in some, we don't have it in others. We've got the facilities, we need to use them better. Secondly, there are some regulatory changes. Through my initiative on council, we created a new parks fund. It's an impact fee that developers pay. That was a tough one to get through. And we need to use those funds to improve neighborhood parks and things like access to parks, such as sidewalks. I've also proposed a sidewalk SWAT team. There's a lot of places where people can't get to where they want to go safely because of the lack of sidewalks. We need some more regulation there. And finally, I would say that I just want to mention the Riverside Health Clinic, which was shut down by a flood. I volunteered my architectural services, and we got the price down, and we got the Riverside Health Clinic back open. And we did that with the help of the local councilwoman. So there's a lot of things we can do on a localized, decentralized basis to make Houston a healthier city.
It's a two-part question, and I want to answer the second part first. As to proposed regulations going forward, I have no proposed regulatory schemes going forward. And the reason for that is because I've been hammering throughout this whole discussion this morning about education, education, education. I think we're at the point where we have to educate our populace about the need for wellness. And I think regulation would be inappropriate at this point. Now, the question of would I encourage council members to have wellness programs in a district? Absolutely yes. But the real deal is for the mayor to lead the wellness program. We've got a strong mayor form of government. The mayor needs to be out in front of council members saying, we're going to be a healthy city, we're going to be a well city, and oh, by the way, I'm going to be in your district leading the charge. I think that'll get everybody excited.
I strongly believe that you cannot regulate good health. This whole idea here has to be a public information campaign. We have to be able, like Gene said, educate. We have to be able to explain to the younger generation, don't wait till we get our age. Think of all the things you can do now to prevent that onset of diabetes, that onset of heart disease. You don't want your arteries to be 50% clogged when you're 50. We need to change those ideas. Now, as far as City Council, Gene said something, I'm going to do it as well. We're going to get out, and we're going to run, and we're going to walk. We're going to show that we lead by example. We're going to take City Council members out there. We're going to take department heads out there. And we're going to show the rest of the 20-something thousand city employees that we're serious about this. And when they see this, they'll follow. And when they follow, the rest of you will follow.